Hi, I'm Dr. Muralidhar, working as a critical care consultant at Kauvery Hospital, Bengaluru. Suicide is a major global health problem. Globally, more than 8 lakhs people die every year. That means one death in every 40 seconds. One third of deaths being in the young population. 77% of this suicide happens in low income or middle income countries. The age standardized suicidal rate is 12 per 1 lakh population. That means it's a huge burden, not only on the people, on the family, but on also society. So how to prevent the suicides? We all know that other diseases or like a cancer or other any medical issues, we do regular screening or primary screening. We can prevent lot of complication with early diagnosis and treatment. The studies done with the suicide, whether we can diagnose early and treatment changes the outcome. Studies have not shown any benefit. So how to go ahead to prevent the suicide? There are a lot of high risk and warning signs which can diagnose suicide and which helps in prevention and better counseling. The high risk includes, most common high risk is attempted suicidal. If patient has attempted suicide once, the chances of repetitions is more. Second is depression and psychological issue. There are a lot of financial problems, or there is a trauma, or there is any cancer or illness, chronic pain. These are the most common high risk. And coming to warning signs, they may be subtle or they may be full blown warning signs. The most common warning sign is change in the behavior, change in the personality. There is a loneliness, there is a depression. Then lot of talk on the suicidal and threatening about the suicides. These are the most common warning signs. Then coming to what are the common modes we see in the world. The most common mode of suicide is pesticide ingestion, followed by hanging and firearm injuries. Pesticide injection is seen in 20% of the cases. Now coming to pesticides, we see a lot of pesticides which are very common even in India. The most common pesticide available in India is called as organophosphorus, followed by rat poison and paraquat poisoning. Initially, there was a lot of challenges in managing suicidal patients, whether it's a suicidal tendency or it's a gesture or as a management. There was a study done where healthcare workers make a major role in prevention and treatment. The study shows that 80% of the suicidal cases come in contact with the healthcare providers. Only 20% of patients come with the contact with a psychiatrist. So definitely healthcare workers, it can be regular doctors or more critical care professionals play a major role in not only preventing and also treating the suicidal cases. Now coming to the particular poisoning, pesticides. As I said, pesticides is the most common reason for poisoning. Among them, organophosphorus is the most common poisoning. We all know that since many years this has been there, but only treatment option is some antidote. Atropine and palm are the only true options available. But the downside is lot day in the hospital, ICU particularly, and lot of complication. There are both short-term complication and long-term complication. Organophosphorus, they say it can be in your skin and muscle for lifelong. So it has to be aggressively treated and managed. Now coming to critical care, there have been a lot of innovations and paradigm shift in managing poisoning patients. For example, what we do in Kauvery is short of innovation. Only few centers in the world has been doing this. There is an entity called extracorporeal blood purification techniques. To make it very simple, it's a cartridge. What we do is immediately when a patient comes, we do regular supportive care like a stomach wash, charcoal. Then immediately we do a charcoal dialysis or cartridge dialysis. That means the poison which is in the blood is easily removed through the cartridge. Earlier it was not possible, but now a lot of studies, a lot of case series has been done and published. In Kauvery we have done more than 50 cases with organophosphorus managed with a cartridge, and the outcomes are good. The best outcome followed by cost effectiveness. Earlier it is a long duration of stay in the ICU. Now with the cartridge, this usually lasts 1 or 2 days in the ICU and ward 1 or 2 days and he gets discharged. So it's a huge innovation and the clinical benefit is seen in this technique. Now coming to hanging. Hanging is the second most mode of poisoning. Earlier hanging is just wait and watch. Two things happen in hanging.